Dédé Wilson of FODMAP Everyday. We are thrilled to be doing this webinar with Dr. Rachel Pauls. All of you know what you're here for. You must be interested in the reintroduction and challenge phase because that is what this is all about. Dr. Rachel Pauls follows the diet herself. Her initial book was the Low FODMAP IBS Solution Plan and Cookbook. And now, whoops, I got things dinging. Hold on, folks. And now she's following up with the Low FODMAP Reintroduction Plan and Cookbook. There you go. She's showing you show the cover, hold it up. There we go. It's fantastic. It's going to give you all kinds of information, including recipes. I mean, people often ask us, I'm ready to challenge garlic. What do I do? Do I just pop the clove in my mouth? Do I cook it? Is it raw? We're going to answer all those questions. So we're going to go for about 45 or 50 minutes. We will get to questions at the end. So right before I turn it over to Rachel, use that chat function as we go along. As questions occur to you, you can write them down there in the chat function. We will not most likely be addressing them in the moment, but we will come to them at the end. So with no further ado, we're at 12:03. So I'm going to hand it over to Rachel because we have a lot to talk about. Welcome, Rachel.
Well, thank you guys so much for having me. I'm really excited to be here. I love getting the opportunity to reach people through various forums. Many of you know me through my food company, my recipes, my cookbooks. My personal journey through the Low FODMAP diet started in 2012, and it really changed my life. And this is such an important part of the FODMAP lifestyle reintroduction that I think has been one of the areas that very few authors have focused on. And so about a year and a half ago, I decided I needed to share my knowledge, also do some research to help guide writing a book about it. And so I'm really excited. It's essentially the only only cookbook that is about conquering this important stage. So today I will kind of start with an outline. And yes, okay. So we're going to start with just a little bit of background about the FODMAP diet, kind of like our just overview real quick. Why is this such an important thing for IBS? How did it start? And then move into talking about what reintroduction means. How does that kind of factor into when you're on the diet? When do you begin it? And then the all important why. So all of us go through a little bit of a personal journey, if you will, about when we're going to reintroduce, when we feel ready, and also trying to motivate ourselves to do it. And so many people, I think, get a little stuck in I'm fearful of taking that step. So I'd really like to go through the importance of that, give you some encouragement on getting started. I have several tips on how the process should work, ways to help you succeed through the process, because at the end, this is really going to be your kind of lifelong gut-friendly way of living. I split the reintroduction process into 3 important stages. So stage 1 is the stage with the challenges of fructose, lactose, and the polyol, sorbitol, and mannitol. And so I'll be going over those 4 different challenges with you. And then we'll move into the second stage, which is going to be the fructan stage and the GOS stage. And then that's kind of the end of the challenges. After that, you move to stage 3, where you would have the combination foods. And we'll talk a little bit about challenges that pertain to those foods. And then, of course, after all of the reintroduction is over, kind of the next steps and some other things to help support you as you have kind of established your awareness of your personal tolerances, but still might need some fine tuning in other areas. So a little bit about the FODMAP diet. Well, this is not some new thing. It didn't just get invented. This is a research proven, well-established medical diet that was first began in publications in 2006. And the initial work is basically centers from the Monash University in Australia. And so we credit Monash with a lot of knowledge and really being the pioneers in bringing this diet to the world. And they are also, as you, I hope, know, responsible for the very important app that I hope many of you have to help guide you through the FODMAP journey. There is a food app from Monash and then FODMAP Friendly, and both of those are very, very important to understanding what you should and shouldn't be eating, especially in the elimination phases, because as you guys probably know, it's not really a very intuitive diet. You can't just assume that one food is low FODMAP because a similar food is. So we've all kind of been fooled by that over the years, I'm sure. So the principle of the diet is to reduce or eliminate foods that cause gas, distension, diarrhea, or gut discomfort. And so you eliminate a lot of different foods and food categories, and that it just gives you a chance to kind of cleanse your gut, reset your symptoms, get your nerves all kind of realigned, rewire your body, and eliminate those symptoms so that you can have sort of a clean board in order to help you understand what your personal tolerances are. And what they found is when people eliminated lactose and fructose and fructans, onion, garlic, wheat, all these foods that are likely to cause gut discomfort, that it really helped tremendously with IBS. And over 70 to 85% of people in studies over the last 2 decades have been improved with the low FODMAP diet. So definitely research proven, but it is not meant to go forever. So it's meant to be a 3-phase diet. During the elimination process, and that might be a 4-week period, a 6-week period, you might do it longer, you might even find you don't need to do it for 4 weeks, but you eliminate all of those triggers and reset your gut and get yourself to a place where you can really evaluate your symptoms and you're comfortable in your body. And so once you've reached that point, the next phase is what should come later. So reintroduction, or the FODMAP challenge phase, is meant to be the next step. And that is the part of the journey where you're going to challenge your body with small amounts of different FODMAP groups to see which ones you personally can and can't tolerate. And it's something that's going to happen over a course of several weeks. It's not something that you can just do overnight. This is something you're going to commit to, and we're going to kind of go through it in a lot of detail. And then after the challenge phase, that's when you get to be kind of living your life knowing what your personal thresholds are for different foods. So Dédé's there, I'm there. It's a great place to be so that you can keep yourself stable and know kind of what you can and can't do when you're out and about, or, you know, living your life. So reintroduction, as I've said, is really not well characterized. So there's not a lot of books, there's not a lot of blogs, not a lot of people talking about it. And I really do recommend, because it is something that's not straightforward and intuitive, if you can at all possibly involve a dietitian, a medical provider, somebody to help you, a professional, then that really is important. Not everybody is able to do that for a variety of personal circumstances. And that's why I feel that my book is really an excellent tool. But if you can, try to involve a dietitian or somebody in your journey. You're going to go through the FODMAP triggers one at a time, and you're going to start with a small amount, then escalate to a medium-high amount, and then a high amount. And in the book, I go through different options for each category. So it's not just one choice. You'll have more than one choice for each challenge group. And it will go through also ways to incorporate that food into your diet in a way that is delicious and enjoyable. So you're going to, during this process, be paying attention to your symptoms. So I do recommend journaling your symptoms, keeping track, whatever a flare is for you, making note of those symptoms. And then at the end of that, kind of knowing how much you can take of each of the FODMAPs. So this is so important. And I know Dédé also really strives to try and educate her followers on the importance of reintroduction. It really, we're not meant to be limiting our diet, restricting our diet on a long-term basis. And there's been a lot of studies that have looked at kind of the overall nutritional balance of people following low FODMAP over long-term, but also IBS sufferers in general. And the studies really show that IBS, people who have these types of digestive disorders, do not have as varied a diet. They don't have as good a nutritional balance. And so increasing different foods and food categories, fruits, vegetables, other things that you might discover that you can tolerate, that's going to give you a lot more nutritional balance. That's going to improve your overall health and well-being. So that's very important. The second point is something that has really come into the medical science literature and understanding of our bodies in the last couple of decades, but it's this concept of a microbiome. So what is a microbiome? Basically, a microbiome is the bacteria sort of lining or inhabiting different parts of our body. And it is actually a normal thing. It's a good thing to have bacteria in your intestines. So there are parts of our body that we don't want to have bacteria. And I know, I talk to patients all the time that don't understand how they can have, E. coli on this part of their body or that part of their body. But in our intestines, you want to have things like E. coli. You want to have different bacteria, and you want to have a diverse number of those bacteria. And the bacteria in our intestines actually work with our bodies in a very positive way. They help with our immunity. They help release serotonin. So happiness, your mood, that actually is enhanced depending on your microbiome. So I always talk about, good food, good mood. My bars are called happy bars because I feel like when your gut is feeling good, you're happy, but it's also on the kind of the bacterial level. The more diverse your gut bacteria, the more beneficial that is for your health and well-being and your immunity and all sorts of other very important things. So your diverse microbiome comes from eating diverse foods. It comes from eating probiotic and prebiotic fibers. It comes from feeding those bacteria with different foods that are actually a lot of the high FODMAP foods provide that good nourishment to our gut bacteria. So having more variety of those high FODMAP foods can actually benefit our body. So trying to encourage yourself to explore those other options is very important. Definitely following a low FODMAP diet too has restrictions. So when you're following a diet in the elimination phase, it can be challenging to go eat out at restaurants. It can be challenging to travel. Many of us kind of get accustomed to bringing things, packing things, knowing what the menus are in different restaurants. But that is something that limits our freedom and can inhibit your sense of well-being or your ability to socialize. And those are all negatives, I think, over the long term of your life in kind of propelling you to stay on this journey. So encouraging reintroduction is actually very positive to giving you more freedom. And then joy from food. I believe food is one of the great pleasures of life. Sharing food, cooking for others, seeing people's pleasure in my recipes. Nothing gives me more joy, but also I enjoy eating, and I think that joy is a healthy thing for me, and removing that from my life was not a positive thing. So fear of food, fear of eating, all the things that we suffer sometimes during our IBS flares, that is something that I want to encourage all my followers to move away from and to understand their bodies better. Okay, so how do we move through this FODMAP journey? Or the FODMAP challenges, I should say. So as I was saying earlier, you're going to be adding a small amount of each FODMAP in each 3-day of challenges. So each challenge will span 3 days. It's very important that when you decide to do this, and you don't have to do all your FODMAP reintroductions at the same time, you could do your fructose reintroduction and then take 2 weeks off and then do your lactose reintroduction, whatever works for you. But you need to kind of commit those 3 days with your break days towards that challenge. So during stage 1, which I'll talk about later, you're going to challenge 3 consecutive days and then have 3 break days after. In stage 2 challenges, you're going to have a challenge, break, challenge, break, challenge, break. So you need to plan so that you're not doing these challenges at a time when you're having, let's say, a bad week at work, or you're going on vacation, or you got your family wedding or something else, because it's very important also that in order to get the best information that you're going to follow an elimination diet the rest of the time. You are going to want to really keep all your other FODMAP triggers level and then just reintroduce that one food category. And that way, if you have some sort of GI symptom like bloating, that it's from that fructose and it's not from something else that you might have not be, supposed to be eating. As I said earlier, it's really important to journal symptoms. In my book, I give an example of how to journal, but keep track of your symptoms. Also note other things that are going on. So let's say you're doing the challenge and you didn't know you were going to have a terrible cold, or you had a fight with your mother or something like that, and you're stressed about it. So make a note of that. Maybe you'll notice later that your gut disturbance could have been attributed to something else, and you might want to do the challenge again at a later date. I recommend challenging the same time every day during the challenge. For me, I think kind of midday is best. That way I have the rest of the day, if I'm going to have a reaction, to pay attention to it. You want to probably do the challenge with other foods, so it replicates future behaviors. So if you were just going to eat the challenge food all by itself, that's not really what you're going to do in your normal life. So in the book, I have recipes that are devoting to each challenge so that you eat it, that challenge food, for example, in the context of another part of your meal. And to answer the other point that Dédé brought up, cooking the challenge food is absolutely fine. For most of these foods, they're meant to be eaten cooked rather than raw. So, and also that's a lot more palatable. You're going to want to limit other gut triggers during the challenges. So you will, of course, be on the elimination diet, like I mentioned, but if you are somebody who doesn't do great with carbonation or caffeine or spicy food, probably I would not suggest that you have those other triggers at the same time you're doing the challenge either, because that's going to kind of mess with your results. I recommend sticking to that same food through the 3 days of the challenges, and then advancing as you can. So if you are doing a challenge and after the 2nd day, you think you had a reaction to the food, then don't do the 3rd day. Just kind of pause and reset. And if you're uncertain, you could always re-challenge with that 2nd day amount again, or you can kind of keep that as your the amount that you tolerated and move to the next challenge. All right, so reintroduction stage 1, that is the first stage of challenges. And I intentionally start with the foods that are felt to be the most likely to be tolerated. So the idea being you succeed and you get a lot more information about things you can tolerate early on. And so the research has shown that the foods like fructose and lactose are the ones of the FODMAP groups that are more likely to be successfully challenged. With this category, you're going to do the 3 challenge days followed, or 3 break days, 3 challenge days, and then 3 break days again. And it's going to be the challenges of fructose, lactose, and then the 2 polyols. So this is something that I think is a little interesting for those of us who know the FODMAPs are in different categories, and the polyols, sorbitol and mannitol, while they're still polyols, they're actually processed by your body a little differently, and different people have different tolerances to those 2, where just knowing how you tolerate sorbitol might not translate into how you tolerate mannitol. So therefore they're challenged separately. And they're also reported separately in the apps that most of us have. The sorbitol and mannitol are called out as individual FODMAPs. So how do we do the challenges? Well, this is an example of honey as a fructose challenge. And I like the idea of honey because it's such an easy food to add to the rest of your diet. And the amounts for the challenges are not so large. So it's very easily incorporated into your tea or stirred into your yogurt. The first day you would have a teaspoon and a half, the second day 2 teaspoons, and the third day a tablespoon. And so during that time, you would add that honey to your food, follow an elimination diet the rest of the time, keep track of your symptoms, and then see if you can tolerate honey. And if you can, then you can translate that into the other fructose foods that you might want to enjoy. So in my book, I also have recipes that accompany the different challenges. And so this is the mannitol challenge in the stage 1 of the FODMAP challenges. And for example, with mannitol, you're going to be challenging celery. And in this, for this recipe, I have an orange almond salad. The nice thing about this recipe too is that if you wanted to also later on with your GOS challenge, you're going to be challenging almonds, you could always go to this recipe and add the almonds to this recipe and escalate the amount appropriately. So the challenge food, if you make the salad for the first day, you'll add a certain amount of celery. For the second day, you'll add a little more. And then for the third day, a little more. And that way you find out if you tolerate the mannitol. Okay, so once you've gone through stage 1, then it's not time to start adding those foods, even if you tolerated them. Don't quite start incorporating them in your diet, at least not when you're challenging other FODMAPs, because that's what you're going to do later during the combination challenges. But for stage 2, you're going to start the fructans and the GOS. And for many people, the fructan group is actually, that is a group that is a little less likely to be tolerated. And the FODMAPs don't move through your body as quickly as they do with the first group. So the challenge days are separated by break days. And this is an important point too that I talk a little bit about in my book, but the concept that what we eat doesn't necessarily turn into symptoms immediately. And for many of us, it's difficult to know whether a food caused a symptom because it doesn't happen right away. So foods don't typically cause a reaction within an hour or 30 minutes after eating. It's actually 6 to 8 hours later, or sometimes longer, that you might start to have the symptoms, because the food has to go through your stomach, through your small intestine, and then typically get into the large intestine where those bacteria are that are going to break it down and create gas or other symptoms from the FODMAPs. So very important to give yourself time to react to the food and then record your symptoms. Now, the thing about fructans is they are not a straightforward group of carbohydrate. So because they aren't all digested the same, the category of fructans has 4 subcategories. So for this group of challenges, you have 5 challenges to go through stage 2. And the fructans is broken down into the vegetable and fruit category, then the wheat category, then the onion category, and then the garlic category. And we do these all separately because people have been shown to react differently to garlic than other FODMAP fructans. Same onion tends to be a pretty significant trigger for a lot of people, and it needs to be challenged separately. Now, I didn't mention earlier, so I do want to just cover, if you are somebody who has celiac disease or you're somebody who's lactose intolerant, you're not going to necessarily do the wheat challenge and the lactose challenge, and that's absolutely fine. You just would skip over that and move on to the next challenge. And then the last category is the GOS. So a sample challenge food, as we talked about garlic, again, garlic is something that a lot of people react to. And the amount that you're going to be challenging is really not a very big amount. So the first day you would do a half a clove, or I would always recommend weighing your food because you can't rely on a clove being, one clove is not the same as another clove. So 1 gram for the first day, then a break day, then 2 grams, and then a break day, and then 4 grams. Even if you pass all of these challenges, though, bear in mind, that's not necessarily going to mean you can have garlic toast or Caesar salad or something of that nature at a restaurant. You aren't necessarily going to have the same amount of garlic that those products have. So just being aware that 2 cloves might still not be quite as much as they have in a lot of food that is at restaurants. But for garlic, this is a very easy food, again, to just kind of add into a recipe. So you can just sprinkle it over your steak or fish. You can roast the garlic cloves, which is in my book, how to do that. And then you just mash them up and spread them over some bread, or you can add them to a salad dressing or something else and incorporate them into your meal. In the book, I have a delicious recipe for barbecue chicken pizza. You can certainly use this recipe for the elimination phase and just omit the onion. But for the challenges of the book, you add the red onion in a small, medium, and large amount for each day of the challenge, and then monitor your symptoms. Okay, so once you've moved through stage 1 and stage 2, and you know kind of your tolerances, that's when you can move on to stage 3. And you could decide to do the challenges with stage 3 with a break day between, like you would with stage 2, or you can do them consecutively. I typically, being on the conservative side, recommend a break day between, since many of the combination foods have a fructan or GOS involved. But that is something that, of course, is a personal decision. And there are some foods that already have combinations of FODMAPs in them that you could just use that food as a whole food and challenge it like that. For example, cashews or watermelon, apples, those are all combination foods. Or if you prefer to do it with, let's say, part of a challenge of a fructose and part of a challenge of lactose, then you could do that too. So you could say have yogurt with honey and challenge your dairy and your fructose at the same time if you wanted to do that. For the combination of GOS and fructans, for example, cashews are one of the foods that contain both of those, and there's allocated portions suggested to do this challenge. This is a food that you may or may not want to challenge, depending if you like cashews or if you want to eat that many cashews on a regular basis. But for me, this is one of my favorite foods, so definitely want to know if I could tolerate that. And there are examples of how much cashews you might want to add to your food. You could certainly have these plain. You can enjoy them with your oatmeal or over your ice cream or something else during the challenges. And in the book, I talk about the challenge of plums, which has sorbitol and fructans. And I have a recipe that you can use in your microwave just to make an easy personal size berry crisp. And you could also use this recipe and incorporate blueberries or rhubarb and just enjoy it anytime during the elimination phase as well. So just a little bit about what happens if you have a reaction to a food. Let's say your reaction is gas, bloating, diarrhea, and that happens. Please do not consider that you have failed in any way, or that or get down on yourself about this, because all of us are going to have challenges that are not tolerated and challenges that are. And so just, take a moment, pause, move on to your break days, and give your body a chance to reset. And maybe you'll want to re-challenge it later. Maybe you'll start with a smaller amount than the first day of the challenge food and see, okay, I can't have a half a clove of garlic. Maybe I can have a quarter clove of garlic. Maybe that's still enough for me to enjoy. Or you could say, I'm going to do this challenge in a year or 6 months. Maybe it's the medication that I just started and my gut is not feeling its best. Maybe it was that time of the month for me, or something else where you think your body might do differently later, because we are not static. Nothing in our lives is static. The only constant is change. So don't assume that your body today is going to be your body later in your life, and you can always reassess that. And then there's, of course, other things that you might want to do. So I'm going to talk a little bit about how we fine tune our sensitivities once you've moved through all the challenges, and now you might want to add some things to help your body with its tolerances. Okay, so the next phase is integration and personalization. And isn't this just such a beautiful slide? I could look at these things forever. They're so exciting and delicious looking. So, I mean, the whole idea is we're going to enjoy food and start to expand what we can have. You can do this at your own pace. There is no set schedule for how you want to move forward with the phase of integration. But once you know your personal thresholds for each of the FODMAP categories, then you can start to do 2 or more at a given meal and see how you do. Bear in mind that if you do have reactions, that you can't always say it's a FODMAP related issue. So I think that many of us kind of get focused on, I had a reaction, it's the FODMAP, it's the food. There are other components to foods that we can all react to. And the FODMAP diet is not 100% in everybody. So if you react to something, it could be that there is something else in that food that's not a FODMAP that you don't tolerate. So being just a little aware also of other components of foods that not everything is just as black and white. There's a lot of other things going on that affect our body's tolerances. And then keep going, increase your intake based on what you find out. So in this future lifestyle of your personalized low FODMAP diet, you may still find that you're not 100% all the time. You have flare-ups, you have sensitivities, and that's when you can, again, and working with dietitians and your medical providers is always recommended, but you might start to add some other things to your life that we have told you to hold off on until now. So we don't recommend you start probiotics or a lot of fiber or enzymes when you're starting the low FODMAP diet, because it's just muddying the water. But now you might want to start looking at some of those things. And just in general, stress, keeping ourselves mindful when we're eating, things like meditation, yoga, all of these things have been shown to help with IBS in general. So incorporating those things is always recommended for a healthy lifestyle and optimal gut health. Probiotics, there are several probiotics that have been found to help with IBS, so you may want to explore adding that. If you are somebody who has constipation, adding fiber to your diet is also a lot of evidence to support it. And there are different types of fiber that are low FODMAP or approved for IBS. Hypnotherapy. So this is something that you may have seen. There are companies that offer audio things to listen to, hypnotherapy type courses and programs. And there is a lot of evidence that supports that there is a role for this in treating IBS. Enzymes are a great tool for all of us that are going to discover what we can and can't have. Fine tuning that diet, especially if you're going out or traveling or at a family function, adding some enzymes in your purse that can help with lactose tolerance, that can help with fructose tolerance, that can help with some of the fructan tolerances. And there are a lot of more products now that have, than ever before. And so those are great tools. And then there's also supplements. So glutamine, for example, there's been some research that shows adding glutamine supplementation, which is an amino acid that can help with GI symptoms. There are a lot of other things that you might look into. So just to conclude, low FODMAP is really not meant to be a restrictive long-term diet. I think we've probably hammered that into your head through this lecture, but just to, circle back, it's reintroduction is all about you. It's for you. It's guided by you. You are in charge of this. You're going to pick which food challenges you do. You're going to pick when. You're going to pick which of the choices. And you are going to guide this process. And it's really about empowering yourself to understand what you can tolerate so that you can free yourself of some of the restrictions that you've had while keeping your gut healthy. Gut health is dynamic and not static. So be flexible, explore other changes as appropriate. And really, the goal is to have a healthy and happy relationship with food and your gut in the long term. So just a little bit more, just to circle back again to my book, what would this could give to you that you might not have gotten from the lecture today. A little bit more background about the low FODMAP diet and skills. And there's 60 recipes in my book to help support the elimination and the challenges. It has a step-by-step guide to each FODMAP reintroduction phase with curated recipes. Lots of tips for success and the integration phase, and really everything you need to get to that modified low FODMAP diet, lifestyle, and improved gut health.
Yay.
Thank you for listening to all that.
That was great. Thank you so much, Rachel. We do have some questions, which I'll get to in a moment. And then I've been taking notes, and there's some highlights I definitely want to point out before we end. But two different people asked about meals for one. Is there a way in the book to follow the recipes, but just cook for one?
So great question. And one thing that I'll tell you about the book, which a lot of people ask me this about the first book, but there is a nutrition panel on every recipe. So calories, protein, all that, each recipe has that. There's a lot of recipes in here for one person. Like the garlic challenge is like a one-person meal. There's a lot of recipes that really are for one person, but if you are going to say half the recipe or cut it into fourths or something, I think you'd have to, like, for example, this, like the chicken piccata is for 4. So you could either make it and freeze some of it, or you could have to mathematically, I guess, have everything if it's for 2 people. But there's a lot of recipes for one person in this book. Yeah, because I do a lot of cooking just for me.
We have a question about garlic or onion powder. Now, I'm not sure what the question is, but obviously we can talk about.
We all have questions about garlic and onion powder, like how much can we use? I'm guessing is the question.
I don't know, maybe, or is it the same as fresh garlic? Could you use it for challenges? I'm not sure, because it just says, what about garlic or onion powder? So why don't you just tell us what you want to
Yeah.
share about garlic and onion powder?
Sadly, we don't know what an actual amount for either of those herbs or spices, whatever we consider them. There isn't considered to be an equivalent for a fresh, at least nothing that's been tested in any of the apps. So you really can't use that as a substitute for the fresh, at least not for the challenges. If you were certainly you can opt, if you've passed or you feel like you tolerated onion, feel free to test your own personal tolerance. Like I imagine, Dédé, I've never looked this up, but you can look up, say, like how much parsley is fresh is the equivalent in dried parsley, right? So if you're making in a recipe, sometimes you don't have fresh parsley and you want to use dried. I wonder if there's anywhere that you could say what's the equivalent of onion powder to like fresh onion. I've never looked it up.
Yeah, I think it would be tricky. And also, as you said, I mean, so garlic and onion powder might be used a lot in recipes or rather restaurant things that restaurants are serving you, or in products that you might buy or be served. And so, what do you think of this, Rachel? So we know how to challenge fresh garlic and onion. So if somebody challenges fresh garlic and onion, and let's say they do okay,
Right.
then even, what's important is for each of you to know how you're tolerating whatever it is that you're testing, right? Not what a lab says. So maybe try then a challenge where you try garlic powder and onion powder and see how you do. I mean, we're not going to be able to get any broad scientific data from it, but it might help you understand. And then if you like to cook with it, you'll have some answers.
Yeah, oh, for sure. I agree. Like maybe you'd start with a quarter teaspoon or half teaspoon or something, whatever would be, geared to your lifestyle. So,
right. I mean, I think even less. I mean, sometimes you put half a teaspoon in a whole recipe of something, right?
yeah, sure.
So, then we have a question. Someone says they're on medication. They particularly mention Linzess. They've had gastritis, and they want to know if they should wait till they are over, or can I tell right away? I think what that means is, should they wait until they stop taking their medication and until their gastritis is under control to try challenges and reintroduction?
Well, I would say if you're unstable, I would not recommend a challenge. But let's say you're a person who is on Linzess and that is your life, like that's your baseline. That is where you are. You have no intention of going off of the Linzess. Then I would say go try the FODMAP diet. If you're doing well, then start reintroducing. If the ultimate goal is I want to get off the Linzess, then I think anytime you're making changes to your medications, I wouldn't recommend also making changes to your diet. The fewer confounders, if you will, in your reaction, the better. So
we have a couple of people who say their symptoms have never really gone away, even during elimination. And they're understandably frustrated and don't know what to do. I mean, you sort of just answered, certainly, you're not going to progress to challenge phases until you've come to a place where you have a nice, calm baseline. So then the question is, they've tried, they don't have a calm baseline. I mean, I know one thing that we talk a lot about in the groups, and I don't want anyone to take this the wrong way because we're not trying to blame anyone for anything. Sometimes people think they've been following the diet, but maybe they haven't been.
yeah, so this is like 7 fixes for when the low FODMAP diet fails. That's in this book, the second book. And it talks a lot about fully committing, making sure they have accurate lists, stick to the portion sizes, read labels, be careful of stacking. Like I hear exactly what you're saying. I see it with patients come in and they're like, oh yeah, I've been following that. I'm eating this kind bar. And I say, well, that's not low FODMAP. Oh, but it says gluten-free on the wrapper. It's got to be.
Right. And I'm just laughing. I'm not laughing at it.
I mean, I'm not laughing at them, but
it's so common. You're not alone. You're not alone. And so so to put a positive spin on it, it's not you. It could be that you're relying on resources or things that are
Right.
leading you astray. And this is the other reason to work with a dietitian, right? I mean, we understand that it can appear or can be unattainable for some people financially, but if you're spending your time, and think about all the money you've spent on foods that are not agreeing with you, maybe supplements, all these other things, and time, you're spending all this time in pain. Sometimes a dietitian can tease out the problem.
Yeah. Well,
Someone
and
wants to
there's a lot
know
of
about,
mythology in the handouts you get from your doctor. There's lots of websites that have inaccurate recipes that they say are low FODMAP and they're not low FODMAP. There's old data, out of date food lists. So yeah, sometimes people are getting really the wrong information.
yes. Someone wanted to know about acupuncture. I mean,
Yeah.
obviously we're talking about the low FODMAP diet. I mean, what do you think? I mean, it's a fairly non-invasive thing. Like, why not?
Oh yeah. So acupuncture, there's lots of research that shows it's very useful for IBS. So I would say I didn't actually mention it, but I 100% tell people acupuncture has a lot of research to support for IBS. So definitely for one of those additional things, like when you're talking about the mindfulness, meditation, acupuncture, holistic sort of lifestyle changes, those are all pluses.
Mary Ellen wants to know about Metamucil, that it helps firm stools, but is it just help with constipation? I mean, I think Mary Ellen is one of our groups. I mean, I think that's the kind of question where we can't really address this here because we don't know a complete medical picture of what's going on with you.
So Metamucil, you can use bulking things like that for both constipation and diarrhea. It depends on the nature of your diarrhea or your fecal incontinence, but bulking your stools and adding bulk can help forming the stool, and that can also help with diarrhea. So things like Metamucil are not necessarily just for constipation. It's very different than a laxative. So yeah, I think that's a great thing. Citracel, Metamucil, help bulking, help with diarrhea, help with constipation.
Okay, Linda, Linda, I love this question. We ask it all the time. Okay, so Linda says, is there a database with the amount of each FODMAP in each food? So, I mean, you know the rest of the question, right? So that we can all really drill down to the nitty gritty. So here's the deal, Linda.
Linda, is it Linda? You said Linda.
Yeah.
You are a woman after my heart.
Both of us.
I have been begging. This used to be my personal mission. Have it on food labels, have it broken down into the categories. It's so frustrating sometimes, but like Dédé said before we started, if you're a type A, if you think this is all going to be pure science, mathematical, you're going to be disappointed.
So let me just answer the question really quickly, Linda. So no, the answer is no. Basically Monash and FODMAP Friendly are the two entities who are doing the lab testing. They're sharing the results that they are willing to share in the apps. They do not share the API publicly. We do not have access to that database. So that is that answer. But I just want to point out one thing. Even if you had access to that and you thought, and you're a math whiz and you're like, okay, because she mentions avocado and red pepper in the same meal. So let's say you did the math and you're like, I now know, according to the lab, I can eat this much avocado and this much red pepper. I'm going to put it together and I'm going to have a salad and I'm going to be great. We don't know you're going to be great because your GI tract isn't a lab. You may have a negative reaction, or maybe you can eat twice as much as what the database would say. So even though we all wish that database existed, the fact is that in practical application, there's like a lot more going on. Okay, Mel wants us to post links to products. I don't know. Okay, we will definitely make sure everything mentioned is in there. We have people mentioning that they're losing weight, and we have people mentioning that they're gaining weight.
Yeah.
On the diet.
Yeah, I mean, we see that. I'm sure you see that in your comments of your recipes too. Like, this is fattening, I'm going to gain weight. And then there's people that have IBS that are like underweight and need to gain weight. The low FODMAP diet is not a diet for weight maintenance, loss, gain, what have you. For most of us that are doing recipes for this, our mantra is we're restricting foods already. We're creating recipes to help enable people to enjoy foods that they already feel restricted. So I don't necessarily have calorie count, like low fat, low calorie recipes per se, or diabetic suitable recipes or whatever it is. But I think within any scope of any diet, any eating plan, you make decisions to select either the higher calorie or the lower calorie things, right? So for Dédé and I on our blogs, I'm sure Dédé, you could suggest dozens of lower fat, healthy options, seafood, salads, for more weight loss oriented people. And then you've got probably your butter laden things.
Robin, I'm sure Robin's taking notes. We actually have articles on at FODMAP Everyday, one addressing people who are dealing with weight gain, and one article that's addressing people who are dealing with weight loss. So we do have those articles, and we'll include them in the follow-up. Someone wants to know if this diet works for methane SIBO. Do you answer that, or do you want to?
I mean, I think SIBO in general, low FODMAP diet has been shown to help with that. I don't know what methane SIBO is referring to. I've not heard of that classification.
We have some information on the site, and we will include that as well. So someone here said they want to know if sorbitol is different in food, if it's different in food or medicine or gum. I guess like if they see sorbitol.
Stay away from gum. I mean, the gum is like, I think that's a very big trigger. Actually, we give the gum to post-op general surgery patients to help with gut stimulation and encourage gas because it does that. And there's like only 2 brands of gum that don't have sorbitol in them. I think like Hubba Bubba. I've looked into this, Bazooka maybe, but you can't chew gum if you follow low FODMAP unless you determine you can tolerate that amount of sorbitol. But I don't suggest it's medicines. I always screen all my medications for sorbitol. I mean, I think that's the sort of thing that if it's just a tiny amount, you'll probably tolerate it. But for a lot of people, like chewing gum, we go through a lot of pieces of gum in a day. So I think that's where it could add up differently than just having your gummies or something with your vitamins. Those all have
a question about, it's a pediatric question. So this person's 16-year-old is in reintroduction. She did a perfect 4-week elimination phase. Well, I want to talk about that wording for a minute. All of her symptoms disappeared except for diarrhea. Should she wait to introduce? So this makes me wonder a whole bunch of things, right? So you're saying she went through 4 weeks of elimination, diarrhea hasn't gone away. So she's had diarrhea for the 4 weeks, and I'm assuming she also had diarrhea before. When it comes to kids, it doesn't matter whether they're 16 or 3 or 6 months old. Working with a pediatric dietitian is really important because we have not only the FODMAP thing and the IBS thing that you're trying to get a hold of, but you're dealing with all a 16-year-old, all these hormonal changes, the regular growth things that we deal with kids. I mean, what would you say, Rachel?
Oh, I'm agreeing with all of your saying. And I also think eating disorders trigger big time is a problem in the teen girl population. Not to say that this girl is or guy is at risk of that, but a lot of 16-year-old women or girls are practically women in a lot of ways. So I think, but the question, it's a little tricky. So I'm assuming too, like you said, Dédé, she had diarrhea before, she still has diarrhea. Is diarrhea what you're looking at the FODMAP diet to fix? Is diarrhea bothersome? Is that your flare? Is that something different? Have you had other infectious, other processes ruled out? have you had stool samples? I mean, there's a lot of like medical questions that I think would be important to address, but I think that needs a little bit more of a deeper dive in general.
Okay, we have, oh boy, we're going to have to wrap up. Elaine, your question is a little complex. Hold on one moment. I'm just like really reading fast. Someone mentioned all beta blockers seem to have lactose. Okay, so Elaine, let's see if we can do this really quick because I do want to mention a few highlights. So she's having problems with fructans. But she's doing okay with wheat. She did pass the first 2 onion tests. I mean, I'm just going to take a stab at this and say, Elaine, I mean, it sounds like, I mean, you've divided all your fructan tests. You're doing better with some than others, which is great. I mean, that's why we have 4 fructan tests, right? Because you might pass some at some level or all levels and not other fructan tests. I would say just wait a couple months and try the garlic again. I mean, you seem to be doing well with the wheat and onion. You know, it could have been something else though. Who knows? Were you stressed out? I mean, all those non-food triggers that Rachel mentioned in the beginning. You know, so we're not really sure what came into play. Okay, one last question about pantoprazole. Oh, this is a whole bunch of medication, Nicole. So Nicole, we can't really give individual medical advice on medication. Could maybe Nicole just follow up with you directly about some medication questions? I think that might be the best way.
Yeah, she could certainly send us an email at Rachel Paul's Food.
Why don't we do that? Because I don't really want to have a broad personal medication conversation.
No, I think that, yes.
So this is great. We have 2 more minutes and I just want to point out what I thought were some real highlights. I want to end on an up note. So and this is no particular order. So at one point, Rachel mentioned, you know, your gut is not static. I love this point. If you're not doing well with a particular food right now, or you're not doing particularly well with a challenge right now, it doesn't mean that it's going to be that way forever. So don't give up. You can do challenges again later on. I love that you addressed weighing things, right? So a garlic clove can look like that, and a garlic clove can look like that. So if you're going to really do your challenges in a really structured way, using a digital scale is going to help you because you're going to be able to keep a better track on what you're doing there. You mentioned, you know, way in the beginning when we were talking about the whole point of this phase of the diet, that this is all about discovering what you personally can tolerate or not tolerate. And any of you who are in my groups know that we try to hit this home all the time. Asking other people, well, how did you do with your garlic challenge? I mean, people are going to say, I did great, I did horrible, I'm not even sure. You're going to get all the different answers, but the answer that is most important is the answer that you're getting. I love that you mentioned that all of those supplements, all those things that maybe could help you, probiotics, digestive enzymes, all of these things that might be able to help you have a broader relationship with food are best introduced into your diet after you've finished this reintroduction challenge phase. Because taking these things early on, I mean, the idea of taking a pill and having your symptoms go away, we know is really, you know, hard to resist, but you're trying to assess your relationship with FODMAPs during the first 2 stages. So you just want to put that off a little bit. And then I guess the other thing was just the non-food trigger. I think that that's huge. I think people do the challenges and they might have a reaction and immediately their thought goes to the food. But as Rachel mentioned, did you have a fight? Did something happen at work? Are you giving a public speech tomorrow that you're nervous about? I mean, did you not sleep well?
Mm-hmm.
There are so many non-food triggers. So we just need to be kind to ourselves and sort of look at the big picture. And we do have to tie this up. Rachel's book, the FODMAP Reintroduction Plan and Cookbook, is going to answer all these questions and more. Everyone that's here, you will get a recording. Please be nice to Robin. It takes her a few days to put together the newsletter, but it will be nice and beefy. You will have a link to view this again. You will be put into the running for a drawing for free cookbooks. You'll get links to all of the articles and the things that we mentioned. So Rachel, just you can close it. What would you like to say?
Just enjoy food, enjoy the journey. If you're feeling better, that's really all that this is about. And I'm just very grateful to be able to talk to everybody today. And I'm very grateful to Dédé and Robin for their blog and their website and everything they do. I think they're really absolute pillars of this community and have done such great work. So I'm just happy to be here.
Oh, and don't forget Rachel's products. I was just using your beef stock last night. So, oh, good. She has some of her stuff there. All right. Well, we're going to tie it up, guys. Thank you so much, everyone, for coming. Thank you, Rachel. Thanks, and everybody go out there and order the book.
And have a good, beautiful summer day.
Yes. Bye-bye.
Bye.